Patient-informed consent is very important to me, especially if a brain surgeon is going to be poking around my head, for example. Today I have the flu, and over-the-counter remedies aren't working, and I missed my yearly shots. I'm gonna go see my local clinic to see if I can be prescribed a stronger ibuprofen pills to deal with my body pains and headaches. Sitting in the waiting room, I scan the faces sitting to see how many have rosy red cheeks like mine, or how many look like walking zombies with bags under their eyes, or how many have the flu just like me. As my last and first name are called by the nurse, I'm escorted through hallways to a small cubicle with the typical doctor's bed with wax paper on it. And I'm instructed to sit and wait for my typical doctor. So far so good. Everything as I remember when coming to a clinic. But this time I'm surprised with a friendly knock and a friendly introduction to a different doctor who said that he is a colleague of my regular doctor and says he's out on vacation. He then changes the pitch from him prescribing me meds for my fierce flu to me participating in a clinical trial, he called it. This subordinate doctor to me explained how a new name brand of ibuprofen was passed by the FDA, which would help me with my flu symptoms. My safety was guaranteed, and that my participation in this clinical trial would require nothing more of me to take my regular routine of going home and taking the medication as directed until my symptoms go away. The twist is I will have to come and report back to the clinic with a take-home survey asking me about any symptoms. The doctor went on to explain how beneficial and helpful towards this new brand and to other patients this will be. He explained that this clinical trial will help to see the benefit of it over the standard ibuprofen and if it heals the flu symptoms better and faster. Kindly I agreed to be a part of this study. As to me, I will still get the meds I came here for, but a different name, no biggie. And I came to know I'm a part of a helping community of patients doing our part to help others. But when the doctor said words like control group and data analysis, I began to feel like a guinea pig of sorts. Was there more to the doctor's intentions than what he said? There was paperwork I had to sign, and it was labeled from the not from the clinic, but from the company of the new ibuprofen. Before I signed, I asked the doctor what is in it for him, and he replied that the clinic will be able to help patients better by partnering with the new ibuprofen company to find the results of this clinical trial. This wasn't as planned when I went to the clinic today, and hopefully my gut told me I was right for doing the right thing by being a subject in their clinical study of this new and improved ibuprofen. But in the back of my head, I still walked out of the clinic that day, hopeful that my flu will go away, but doubtful that I am not really just the doctor's guinea pig. What if I just said no, thank you, and would like my regular ibuprofen prescription instead? I felt much like I need a no soliciting sign on my forehead the next time I go to my clinic.